Okay, I think that's most people in now. So welcome. I hope everyone's enjoying a nice summer, and welcome to the fourth Scottish Health Equity Research Unit webinar. My name is David Jack. I'm a Senior Knowledge Exchange Fellow at SHERU. I'm also part of the Fraser-Vallender Institute. First thing I wanted to say is we are recording today's webinar, so hope everyone is okay with that, just to allow others who can't make today to be able to watch it back. As we've done with all of other webinars, this will be made available through the SHERU website. I just want to say a bit about the agenda today, so I'll just quickly share my screen. So the focus for today's webinar is air pollution policy and socioeconomic inequality. And the agenda is as follows. So we'll start off with Allison. So Allison is an economist and a knowledge exchange fellow here at SHERU. She's going to talk about understanding air pollution and socioeconomic inequality in Scotland. We're then going to move to Professor Grant Allan, who is going to say a bit about the consequences of urban air quality interventions and what the academic literature says. So Grant is a professor here in the Department of Economics at the University of Strathclyde. Grant's research focuses on the connections between economic activity, natural resources and the environment. And then we're delighted also to have Justine Holmes with us today. Justine is the Clean Air Lead at ShareAction, and Justine's going to talk about the invisible risk, the case for accelerated corporate action on air pollution. So the plan is that we will, in a moment, go straight into those presentations. Each speaker is going to talk for roughly around 10 minutes, and we're going to just follow back to back to leave hopefully around 15 minutes of time at the end for question and answer. So if you do want to ask a question as we go along, I would encourage people to enter questions within the Q&A function throughout the webinar. Please do state who your question is for. Or if it's for all presenters, please also say that also. So I think I'll just stop sharing and go straight into asking Allison to kick off. Thank you.
Yeah, thanks so much, David. Give me just 1 second to get this going. All right. So I'm going to talk about some work that we did as part of SHERU, looking at air pollution and socioeconomic inequality in Scotland. So this report came out back in April. It looks at 2022 pollution levels to kind of see where there might be some inequalities in pollutant exposure. So part of this, SHERU was set up in 2024, if you're not familiar with us, to drive action on socioeconomic determinants of health inequality. I think looking at the list of people who are attending today, a lot of you are, like a lot of people here are experts working in air pollution. But when we first kind of proposed this to our funders, the Health Foundation, it was a bit of an odd choice, I think, because a lot of what we do ends up being looking at inequalities in housing, employment, and looking at inequalities for children and young adult men kind of tends to be our focus. But Scotland has a wide range of unequal health outcomes. A lot of those are correlated. Some of those include health outcomes that are correlated with poor air quality. And previous studies have found there are really big gaps in Scotland and in the UK between people from ethnic minority backgrounds, people from white British backgrounds, and people living in deprived areas and people living in non-deprived areas in terms of the levels of air pollution that they experience. One thing that's positive, Scotland has made a lot of effort in reducing the levels of air pollution over time. So with that, we kind of had two main research questions. One was, which groups are likely to experience higher levels of air pollution in Scotland? And one was, what are some policy considerations that the Scottish Government can think of in addressing these inequalities in pollution exposure? So we used entirely publicly available data for this. including the census, which is the most up-to-date estimates on ethnicity and ethnic minority populations, which is really important. The minority population in Scotland has grown significantly in the past 10 years. It now makes about 12% of the total population. And in spite of this, there's really bad data on health outcomes for people from ethnic minority backgrounds. There's a lot of missing data as well. We also really wanted to explore poverty, but we don't have really good small area data on poverty in Scotland. So what we used as a proxy for that was income deprivation, the percentage of the data zone that is classified as income deprived, so the number of income deprived households. And one challenge in kind of doing this is that air pollution data tends not to align geographically to socioeconomic data. So a big part of this project was kind of mapping these two geographies that don't really map comfortably together. So some math that I'm going to throw at you really quickly, and I'm sorry about that. So in order to find the pollution concentration within a data zone, which is going to be the smallest area that we have in Scotland for socioeconomic data. So if you're joining us from England, that's going to be roughly the equivalent to an LSOA. So that'll be about 500 to 1,000 people living in a data zone. So to find the average pollution concentration, again, within a data zone, we area weighted that. And then we population weighted to find out how much pollution different groups were exposed to. So here's kind of what that looks like in the end. So the average for Scotland for nitrogen dioxide and particulate matter, which are going to be the two pollutants that we focus on, is obviously much smaller than what we found was the average for the data zone, which is also a little bit smaller than what we found was the population weighted average. So people in Scotland on average experience around 6.1 microgram per meter cubed of nitrogen dioxide in a year, a little bit higher than what we found was the data zone average. So with that, with our two kind of main groups, what sort of things do we find? So first of all, one important thing to note, obviously, a lot of pollution is going to come from vehicles, and a lot of the concentrations of pollution is going to be more heavily concentrated along the central belt. You can also pretty clearly see roads mapped out, especially with NO2. Let's see. So yeah, so really heavily concentrated in the central belt and moving up into Aberdeen. So as expected, in Scotland, on average, people from minority backgrounds and income-deprived areas experience much higher levels of nitrogen dioxide. Some small differences in particulate matter, but not very significant ones. But the difference is really quite striking, especially, again, for ethnic minority, people from ethnic minority backgrounds, which experience pollutant concentrations that are 50% higher than people from white Scottish or British backgrounds. A big reason for this is going to be because people, income-deprived areas and people from ethnic minority backgrounds are more likely to live in urban areas. As we saw on the maps, it's clearly an urban issue. So we wanted to make sure that this wasn't just an urban-rural inequality, it was actually an inequality within these groups. So isolating large urban areas in Scotland, which are going to include Aberdeen, Dundee, Edinburgh, Glasgow, and Motherwell and Airdrie. These gaps are a little smaller, but they are still present. There are still notable inequalities for people from minority ethnic backgrounds and people living in the most income-deprived areas. The inequality based on ethnicity is also quite statistically significant, which we go into the report if you want to look at a bunch of statistical things about it. It's in there. I won't bore you with that today. But what can we do about this for policy? Like knowing that there is this inequality, that this inequality has been ongoing. What can we do about it? Basically, in looking at it, there are kind of two ways that we can consider it. There are universal approaches, and then there are targeted approaches. So looking at universal approaches, what is Scotland doing to reduce emissions for everyone? We kind of considered air quality objectives, which Scotland is likely to consider in the next year. And then for policies which can bridge inequality more specifically, more targeted approaches to pollution, we looked at air pollution and housing tenure and sources of pollution. There are lots and lots of other policies to consider and lots of other policies that discuss this. But these were kind of the three that we looked at initially. So looking at policies to reduce emissions, Scotland has a wide range of strategies. Grant Allan is going to talk about some of these a little bit more in his talk. But, we found some positive outcomes. Again, Scotland's dropped nitrogen dioxide concentrations have gone down by almost half in the past decade, as have particulate matter concentrations. So a lot of this has been really positive. There's some recent news from Glasgow about their LEZ, which is 35% lower, has 35% lower pollutant concentrations than it did in 2022, which is the year that we looked at. Because they're going to be reconsidering their pollution guidelines in 2026. There are a couple different areas that they can consider. This includes WHO guidelines, EU guidelines, somewhere in between. The current rules in Scotland are modeled based on previous EU and WHO guidelines, so we're kind of assuming that's what they'll look at to consider this in the future. Partly because in 2022, Scotland met all of their goals for the first time, so that was a big consideration. That's part of what I think is going to prompt us to reconsider what those rules will be in the future. We've met that goal. What's the next one? So if we look at EU guidelines and WHO guidelines, there's really only one area in Scotland that was in 2022 exceeding EU guidelines, and that was the city centre in Aberdeen, where they'll get a lot of nitrogen dioxide from road traffic, but also from shipping and transport lanes. For the WHO, around 15% of Scotland currently lives in areas that exceed the WHO guidelines. And within that, we found that there were a lot of inequalities as well, which we'll talk about in just a second. But again, so if we're wanting to talk about targeted policy towards bridging inequalities in pollutant exposure, there's a lot of stuff that considers it, but there's not a lot of stuff that is clearly kind of being done to do this. It's considered a lot during impact assessments, but otherwise it's kind of hard to tell when these inequalities will actually be addressed and considered, outside of just saying we want to address and consider health inequality in air pollution. Like I said, we found that there were really big gaps in the proportion of populations that live in areas that exceed these WHO guidelines, most notably, again, people from ethnic minority backgrounds. But by accommodation type, that was also an interesting thing to look at, because what we found is that people living in rented accommodation experience much worse air pollution, both in urban areas and in Scotland in general. Which is important to consider because there's kind of two things that can be acting here, right? Rented accommodation tends to also be lower quality, which means that people living in them are affected by indoor air pollution as well as outdoor air pollution. They might have higher concentrations of indoor air pollution. It's not clear what those levels are, but we do know that especially people in private rented tenures are much more likely to live in houses that are affected by mold and damp and other things that would affect their air quality. On top of that, people living in private rentals are more likely to be low income than they have in the past. They're more likely to have much higher housing costs. So you've got this effect of all these things kind of coming together to potentially exacerbate health inequalities in a way that we don't really know, and that policy is considering but hasn't really actually drilled down on. And the final thing that we considered were pollutant sources. So these show the which human-derived pollutant source is highest in different regions in Scotland for nitrogen oxides and particulate matter. Again, we're seeing road transport and shipping lanes. That's going to be the blue in coastal areas across Scotland. One thing that I'll say before passing on is that for both nitrogen dioxides and pollutant matter, we saw big drops over time in the past 10 years for almost all of these pollutant sources. except for particulate matter, heating and industrial pollution has actually either not decreased at all, or it has actually increased since 2010. So again, an important thing for, I think, people to consider in policy spaces moving forward. All right, so with that, I will pass you on to Grant.
Okay, thanks very much, Alison. And as Grant gets these slides ready, I'll just remind people, if you've got any questions for Alison, please just pop them in the question and answer function. We'll get to them after all three presentations. And as Alison said right at the start, if you want to read more about that piece of work, it is available on the SHERU website. Okay, Grant, over to you.
Fantastic, David. Can I just check you can see my slides okay? Am I sharing them properly?
Yes, you are.
Fantastic. Yep. Okay, thanks. So thanks a lot for the opportunity to present today. You've got the title of what I'm going to talk about there on the slide in front of you. This is some recent work that we've undertaken as part of the GEMINOA project. This was funded by ICLEI Action Fund 2.0. And this was a collaboration between departments of electrical engineering and architecture and the Fraser of Allender and economics departments here at Strathclyde. This looked at indoor and outdoor air quality, emissions and economic activity. We're looking at Glasgow in particular to understand how data is currently used and might be used in the future to support policy actions. Elements of this work have looked at health, air quality, and the kind of subnational data that we have available to us. But the piece of work I'm going to present today is work that was jointly done with himself and Aidan Rooney from the Fraser of Allender Institute. That slide's working. So this was clearly, there's big policy interest in air quality interventions and also the kinds of impacts that these might have. There's an acknowledgement that there's links between poor air quality and a range of outcomes, including economic, social and health outcomes. Cities are a place where all these come together, as well as places which have some of the levers that can be used to make action here, and developing policies in response to the challenges of poor air quality. These policies will have consequences, maybe some of the intended consequences, like what Alison showed earlier about the impacts that the LEZ seems to have been having in Glasgow in its first year. There will also be some unintended consequences. There could be unintended consequences, or concerns that some of the policies introduced might be unevenly distributed across the people impacted by the policy. So good to understand and use evaluation techniques to understand the actual impacts that policies are having, so as to help improve the design of the policies and the place themselves, mitigate some unintended consequences, improve outcomes by redesigning the policy or changing the policy, as well as using evaluations to inform other places about what's worked or hasn't worked in one place and what could be done somewhere else that's looking to do a similar intervention, for instance. So the piece of work I'm going to talk about is a systematic literature review that we did of the academic literature. We looked at this to identify what's the current state of the knowledge on the causal evidence for urban air quality interventions having impacts. Is this a big literature? And then what does it say? What are some of the findings that exist in this literature to date? So myself and Aidan, we reviewed the published literature here. So we followed what's called the PRISMA method. This is for those of you who like acronyms, this is preferred reporting items for systematic reviews and meta-analysis. So this is a systematic way of considering the literature on a particular research question that we have. So the credibility revolution in economics has designed new statistical methods which can be used to look at the impacts of real-world experiments, if you like, and to understand the consequences that policies are having and have had through the data available now to employ these techniques. The specific question we were asking in this review was to focus on those papers which had undertaken air quality interventions that were aimed at private road users at a sub-national level and which employed some of these econometric techniques to establish causality. So we weren't just looking for papers which maybe took a before and after. We're looking for papers which tried to ascribe, or were able to ascribe, using these modern methods, that the consequences had happened as a result of the policy intervention happening. This establishes a kind of further level of robustness on the evidence base here. So the PRISMA method, I won't go through all 2,500 papers that we initially formed the initial kind of scope of our study, but we then applied a range of filtering, reviewing and screening procedures to exclude from this study papers that were not relevant for our research question. So we could rule papers out which weren't specifically air quality interventions, policies which were specifically not aimed at a particular subnational area, be it a city or an urban area, which is what we were looking for. Or those papers which were doing modelling or something that wasn't explicitly a causal evidence. So from this initial papers which formed the broad scope, we got down to 59 journal papers which met all of our criteria for inclusion here. And the time I've got left, I'm going to give you a quick whistle-stop tour through some of the insights from these papers which met all the criteria. So you'll see from the chart here that there's been a surge in recent years in the use of causal econometric methods to look at the consequences of urban air quality interventions, and so which fit our sample. First one we found was 2008. We did this review in February, so we were very explicitly, this was dated February 2025, and even about sort of 2 months in, there's already 10 papers published in 2025 which met our criteria. So we expect to see continued academic work here. This surge is in line with developments in the methods, the availability of data to use these methods, and an interest in evaluating the policy impacts. I should say that these literature doesn't necessarily mean that these are policies which are introduced in these years. It's just this is where the publication took place. And many considered some of the more recent interventions, such as changes in London, Madrid and elsewhere, but some of these were also looking back at things which happened in the more distant past and applying these methods. We found many of the cities which you would expect as having adopted regulations in the last kind of 20 years were found to have had evaluations done using these methods, including some of the ones I've mentioned, many across Europe in line with the use of LEZs and other restrictions in places across Europe, but also in Asia, including China and Japan. So the kind of findings here, just to summarize this, we kind of looked at trying to group the papers that we found and the specific variables that they were focusing on. So whether or not they were considering air quality impacts. And you see that many of the papers that we were looking at, a total of 39 of them separately looked at air quality changes coming from these interventions. We grouped together other changes or other categories under behavioural changes. So this would be things which included changes in actions by individuals, such as use of public transport, their own personal behaviours around purchasing vehicles and so on, different vehicles changing their vehicle ownership, subsequently to a policy being introduced. We also looked at some of the economic things, which include things like changes in house prices, changes in labour supply, and so on. And we looked at the papers which looked at health outcomes, which included a range looking at infant health, adult health, and so on. So we can group these together and try to present the outcomes that we saw from these papers in a table here. So you can see that for the air quality, for those papers that looked at air quality, this was perhaps unsurprisingly the largest number of papers we found focused on this. 39 papers out of our sample looked at air quality. Many of these found a positive impact, so reduced pollution, reduced emissions after the intervention of these restrictions of the regulations. We were reporting mixed outcomes here. This is cases where there's no statistically significant effect found following the policy, maybe with large uncertainties around the impacts, or else where there was a number of different pollutants considered, and there might be positive improvements in one pollutant, but negative changes in another pollutant. For instance, one policy for Beijing found that intervention led to some pollutants increasing, particularly around which seemed to be linked to the adoption of public transport, which was primarily diesel-based buses, away from more efficient, less polluting private vehicles. So those are the kind of mixed, where there was some positives and some negative impacts found within the same paper. Behavioural changes we found included higher scrappage rates around low emission zones in Madrid. Those people who were able to get rid of vehicles which no longer were compliant were seeing changes in the way in which they were taking on their vehicle ownership status in response to the policy change. Some of the mixed outcomes we found there for behaviour were maybe where we found papers which report a short-term reduction in emissions immediately following intervention, but maybe this didn't persist over time. So a couple of years post the policy's introduction, those changes which had been seen in its immediate aftermath didn't persist. Also for Madrid, we found some really interesting work talking about the extent to which improvements within the zone were offset potentially by worsening conditions outside of the area, outside the boundary of the zone, to a changing behaviour of the use of the space for travel purposes. So clearly, like the sentence said at the bottom of the slide, these papers are looking in detail at particular cases, and we would expect that the outcomes seen are reflecting the characteristics of the urban environment that's considered there. So the availability of alternatives to those which are directly affected by the restrictions, the cost of those alternatives, and also the pattern of the existing flows of traffic, for instance, in the space, would be clearly of first order concerns to the actual impact that interventions would have in any of these places. No two cities are exactly the same for obvious reasons. Found some really interesting kind of distributional work on that labour supply point I mentioned before in one of the Chinese papers, which found that where there's an increased cost to commuting, those who could avoid this cost did avoid this. They found this particularly impacting on the labour supply of self-employed people who were no longer willing to offer their labour in the zone where they would have to pay the charge to be able to work. But this had no effect upon the labour supply of employees who had no choice about where they were located. So just to wrap things up, we see kind of at this point in time we did this review, a kind of limited but rapidly growing literature in this space. The impacts clearly here are case specific, reflecting the characteristics of the urban system in which they've been introduced. I think there's a really strong kind of message coming through from this work that kind of evaluations can be carried out. They can make use of the techniques that are now available to economists and statisticians to understand the impacts of interventions, and that these evaluations have been carried out and can go beyond the directly targeted metric of air quality, for instance, but also look at a range of other indicators to look at the consequences of interventions and to help to understand the impacts they've had. A kind of final point, just to finish, would include just thinking about the kinds of data that we have currently, which let us understand the impacts. Are we gathering the right kind of data before we do interventions so that we can look at the consequences for those variables before, during and after policies to measure the impacts? And there's some questions about the kind of type of data, the format, the geography, the frequency, the timeliness and so on, which are really important for thinking about good data to use in these modern methods. Further point about the kind of real-time monitoring of impacts. These studies are ex post, so they're looking back at what's happened in the past. Can we use these methods and provide? There was some really interesting work done in New York and having the kind of evidence in real time showing the consequence of some of the congestion pricing there, and that being a really powerful tool for policy design and also for bringing the public audience with the policy to see that see some of the consequences which these were having in real time, helping to bring support for the policy and a bit of transparency around the process as well. So apologies if I've gone on slightly too long, David, but I'll pass over to the chair now.
Oh, that's perfect. Thanks very much, Grant. That's ideal. I'll just let Justine get her slides together. And I'll just remind anyone who has just recently joined the webinar, you'll be able to catch up on anything you've missed as it's been recorded, and it'll be made available through our website. And just once again, if anyone's got any questions, just pop them in the question and answer function. Okay, Justine, over to you. Thanks.
Many thanks, David, and it's a real pleasure to join you on this webinar today, and thank you for those really interesting presentations so far from Allison and Grant. I will be talking a little bit about sort of zooming out a little bit in terms of the global context and looking at really the case for accelerated corporate action and zeroing in on sort of the commercial sources of air pollution. And specifically, we'll talk a little bit about ShareAction's Clean Air Initiative. ShareAction, if you're not familiar with ShareAction, we do work towards raising the standards of responsible investment, and we work on a variety of topics. And within the health team, we are focused on one of our flagship projects is the Clean Air Initiative. So, of course, air pollution is a critical sustainability topic, but it can, with serious health impacts and also growing financial risk, but it can be a significant blind spot for investors and fairly nascent early stage sustainability topic for them to consider at this stage. In terms of the human health impacts, of course, they are undeniable. We know that there are around 8.1 million deaths worldwide. It's the leading environmental cause of death, but also the second highest global risk factor for death and disease, sitting just above tobacco and just behind high blood pressure. That's around 1 in 8 of all global deaths. And we also know that in terms of also what Allison has been talking about, that there are significant inequalities where lower to middle income countries are significantly impacted by air pollution, and particularly also across the world, those living in lower income neighbourhoods, particularly where they are close to major roads and or industrial facilities. The WHO, of course, has restricted around 6 pollutants, of which PM2.5 and ozone have been highlighted as the worst for human health. But still around 99% of the world's population is being exposed to air pollution above those limits. In terms of where we are focusing, we are looking at particularly the commercial sources of air pollution, and that includes sort of energy, transport, industry, and around 40 to 50% of global PM2.5 comes from those commercial sources. We have also heard in a recent UNET report that around 54% of outdoor air pollution can be attributed to the world's largest 3,000 companies. And we have also found through our recent pilot project that too few companies are actually recognising air pollution as a material issue to their business and or reporting on that transparently or setting targets and starting to reduce their impacts. So that's where we are focused. And in terms of the financial risk, we know that in terms of there are risks at the economy-wide level, systemic risks, but also at the enterprise level. If I just start off, first of all, with the risks at the economy-wide level, I think we're looking at risks that potentially are externalities for companies, but for governments, diversified investors, and also taxpayers. These are the sort of health damages and costs to the economy as a result of air pollution can be significant. The World Bank has identified 8.1 trillion per year, or around 6.1% of global GDP can be attributed to the effects of air pollution, with this projected to significantly rise to the year 2060. There are, across the economy, workforce absences. Around 1.8 billion working days have been attributed to air pollution annually. Also restricted activity days, as we see, where there's high air pollution days in places like Delhi more recently, where There can be shutdowns of construction sites, schools closed, transport shut down, and this can have also a direct impact on companies, around 4.93 billion working restricted activity days in 2010 alone. We've also seen across the economy reduced consumer spending, some studies pointing towards 10% increase in PM2.5, leading to 20 to 30 million euros less spent on those high pollution days. That was a study carried out in Spain. But we also conversely see with a 20% decrease in PM2.5, there can be an uplift in the employment rate of around 16% and a 33% labour productivity uplift. So in terms of directly impacting companies, we see three main risks, and this where we are talking to investors about these key risks for companies as well, in terms of reputational risks, legal risks, and increasing regulatory risks. So in terms of reputational, of course, increasing scrutiny on companies' activities and emissions can lead to can destroy value for investors and can lead to boycotts of companies. Legal costs, as we've seen with incidents such as Dieselgate, where companies have significantly rising legal costs associated with defending lawsuits in court, and it can be very costly. In terms of regulation, which I'll focus on for a little longer, is around 95% of people around the world now live under international agreements specifically on air pollution. And we're also seeing around 63% of countries worldwide have ambient air quality standards in place. And as pointed out by Allison within the Scotland context, that is those regulations are being strengthened in line with WHO updates to their own to air pollutants in 2021, and we are seeing just a general strengthening of those ambient air quality standards in other countries too. There are also stricter and incoming standards and frameworks around corporate disclosure on air pollution. We've seen that with the EU's CSRD, and we're also seeing that now with the SASB updates that are happening at the moment and out for public consultation, and also with the GRI updates. So we're seeing a sort of general strengthening of corporate disclosure around on this topic as well, and then also that translating to national level, where key jurisdictions are then looking at national legislation in terms of strengthening that in line with those standards. Of course, Allison and Grant have also talked about the clean air zones and the proliferation of clean air zones in different countries, and polluter pays taxes and fines incoming, but also general strengthening around vehicle and emissions, industrial emissions standards, which raises the stakes for both investors and companies in terms of planning for those incoming pieces of regulation and policy. In terms of the interlinkages with climate change, of course, there are opportunities for businesses here too. Tackling climate change and air pollution at the same time can bring health co-benefits. We know that there are overlaps between key air pollutants. For example, black carbon is a precursor to PM2.5, and methane contributes significantly to ozone. So there are real benefits to businesses tackling these two at the same time. And actually, there are common sources, common pollutants, and the same sectors emitting those pollutants. So there's a real opportunity here for businesses to tackle both of these issues at the same time, whilst mitigating climate change, whilst also reaping the health co-benefits. So overall, of course, we can see the sort of health research evidence base significantly growing, whilst at the same time sort of risks are really coming to the fore. I mean, these are just some articles we've collected over the last months, but particularly here just to highlight that the World Economic Forum has just recently recognised air pollution as a key global risk in its most recent risk report. And this is so just dropping down into our clean air initiatives. So we have been over the last 18 months or so just gauging the investor appetite for engagement on the topic of air pollution. It is a fairly nascent responsible investment topic, but we have seen significant interest in engaging on this topic. And we have also been conducting company engagement meetings and try to understand the opportunities and challenges around this topic for companies to take more progressive action. We are also focused on engaging with key policymakers and key policy frameworks, both at global and national, regional levels, to try and bring in and enhance regulations on this topic too. In terms of our focus moving forward, we are, as I mentioned, engaging with core group of institutional investors, but we're also trying to identify the gaps in knowledge on this topic around the materiality of air pollution, and also from the company perspective, trying to understand more about what the opportunities are to move forward with. There are some great examples of companies getting ahead of the curve with ambitious action on air pollution, such as the Alliance for Clean Air. We've also seen trade associations in urban areas that are focused on bringing policy asks to government to ask for improved legislation on this topic. So there are real opportunities here for companies to get ahead on this topic, and it is going to be something that we'll be continuing to engage with companies on in the coming months, alongside our investor network. And so public policy is also going to be key focus for us. I will leave it there. I'm sure I'm very happy to answer some further questions, but over to you for Q&A session.
Excellent. Very interesting. Thanks very much, Justine. That was great. At the moment, we just have the one question, and I think, Justine, you've probably touched on this for your presentation. So the question is, how should we tackle the experiences being faced within the private sector? So, Justine, you covered a lot of what the challenges and opportunities for investors and companies to proactively engage in on air pollution. Is there any more you would add to kind of what you've said just in response to that question? Or
yeah, I think for investors, some of the key challenges are really understanding and raising the awareness of the materiality of air pollution for companies and businesses, and how they can tackle air pollution at the same time as climate change, and what those sort of interlinkages and opportunities are, and how to integrate air pollution reporting on air pollution into existing climate reporting. It's also understanding how to respond to pushback when companies perhaps have other priorities, or they are hyper-focused on decarbonisation, and air pollution is seen as an additional issue that they may not have the resources to tackle. And so understanding how to respond and knowledge of existing tools and resources that can really help companies sort of move ahead, of which there are several available currently that can really assist companies to move forward very quickly in terms of integrating air pollution into their current reporting. I think some of the opportunities, certainly for investors, are around collaboratively engaging on this topic with other networks of investors already engaged. I mean, we of course work with our long-term investors in People's Health Network, who are engaging with the Clean Air Initiative, and there are opportunities there to sort of share research and deep dive into sort of some key air pollution linked topics, and also for asset owners to engage who are concerned about these sort of longer term economy-wide risks being invested across the whole economy, to sort of engage with asset managers to try to understand or push asset managers to also be engaging with companies to ask questions on this topic. I think from the company perspective, I think this focus on decarbonisation can be used as a pushback to sort of more ambitious action on air pollution. So I think really trying to engage with companies to sort of help understand what existing tools are available to sort of move beyond that and to quickly integrate key air pollutants into their reporting. And we've seen that with companies such as IKEA, who've already moved ahead on that front. Also to bring experts to those meetings, particularly around things like, we're focused particularly on several sectors, including logistics, construction, and those that have road transport in urban areas, which really ties into what Allison and Grant were talking about earlier. But I think some of the knowledge around, for example, tyre maintenance or some more specific issues can be also barriers to action. So really the opportunity to sort of join with other companies and join existing alliances and really learn about the tools and resources that are available can really help to overcome some of those existing barriers. I'll stop there.
Great. Thanks, Justine. That's really helpful. So we've got a couple more coming. One is around what are the plans in place for linking in with policy. Allison, I wondered if that was one you maybe wanted to kind of pick up in terms of the work you've been doing. I know you've been talking to policy colleagues and, socialising this work, where it's relevant, and there's plans to do more as well here as well.
Yeah, I think a lot of the plans for policy are kind of ongoing. I think, like I said, Scotland's improved their air quality quite a lot in the past decade, and a lot of that does come down to trying things and seeing what works. A lot of it will come down to what local authorities are doing and what local authorities are trying, because it is something, a lot of the air pollution policy that's actually going through does come from a local authority area. I think one area that is quite interesting that I want to see how it develops more is going to be on heating and housing, domestic heating. Because if you followed Scottish news, they had a plan in place to change all of the to decarbonize indoor heating in the next however many years, that ended up falling through. I think largely because it wasn't, it has the ability to really exacerbate some inequalities, because the people who can't afford decarbonized heating are probably also the people who are living in highly polluted areas in a lot of cases. So you run the risk of really worsening some of those gaps between the air quality poor people experience and the air quality that more well-off people experience. So that was taken off the table and then reintroduced, and I don't actually know where it stands currently. But I think there's a lot of opportunities, and I know Scotland is exploring a lot of different opportunities for putting things into place, and will continue to do so in the coming year as they're kind of revisiting their main air quality strategy documents.
Thanks, Allison. And just because you've got the floor at the moment, there's another one in for yourself. Thanking all presenters, but also saying, Allison, results of your work are very interesting, especially those related to air pollution disparities. So the question is, are there any plans to explore drivers and lived experiences of these disparities from the qualitative perspective, either through SHERU or other partnerships or awareness of other organisations leading on that type of work?
That's a really interesting question. I think one of the things that we are working on through lived experience is with housing. So we've got some learning sets going on with people working in housing policy in local governments. And, it's not, and employability as well, actually, which will also tie into like transport and things like that. But so we're not working with people looking at air quality directly, but we are looking at how housing issues affect people in Scotland and how employability and employment issues will affect people in Scotland, and looking at lived experience through that. And again, while it's not directly air quality related, there is that line through it where, living in an area with poor air quality, living in an area without access to green space, services, things like that. It's not literally talking about the air quality you experience, but it is, deeply intercorrelated with the air quality that you experience. So my colleague Fiona is listening in today, and she's kind of running some of the learning sets that we're doing with people working in those departments. So maybe she'll take away from it and see.
Yeah, something for us to think about, Alison, as you say, and yeah, it does connect to some of the other work that we've got ongoing. There's another question in here, Grant. I wondered if this was perhaps one for you. So acknowledgement that this is a very technical area, and a lot of people might be put off engaging because of that. Are there ways of making this more accessible for the public and for non-experts and policy-making bodies? And the reason I'm coming to you, Grant, I'm just thinking, what would your thoughts be on that, reflecting on the work that you've been doing in terms of the kind of academic literature review? Is that something that resonates?
Yeah, David, thanks a lot for that question. I think it's very relevant, because at the end of the day, these are, in this case, what we're talking about today was restrictions, regulations, which are directly targeted at particular people in society, road users, vehicle owners. So there's a clearly directly impacted populace. How do you bring that group on board with the policy? How do you design the policy so it's acknowledging the impacts which it will have directly and indirectly, and people across the board can see that the policies are having particular effects, some of which are intended, some of which are unintended. You can maybe mitigate some of the unintended impacts in a transparent way by knowing kinds of impacts which you're seeing. So yeah, in design of the policy, in consultations before policy is introduced, in communication during and after policy introduction, bringing a public on board with you and keeping a public engaged is a really fundamental part, should be a really fundamental part of the policy process. So it's massively important that it is communicated clearly to public audiences across the public. So that's why, so on the Gemino project, which is a broader project of which this is work, we were engaging with Glasgow Science Centre and other charities who did work in schools, and we were involved in putting together messages about air quality, emissions, and the kinds of policies and so on, which were aimed at these audiences that maybe would not be the normal audiences for that kind of story. So I think that's a really interesting part of the project for me as an economist, to be thinking about, well, how do I kind of explain this to school-age children who will then be having chats with parents? That's a really important part of this whole process, is bringing that population from school-age all the way through all the particular groups, and thinking about how you tell the story, a very technical story about measurement of emissions or measurement of air quality, and how you bring people on board with that to understand things. So we've written some blogs which are out of 10. We've had colleagues going on podcasts and so on, which are aimed at these audiences. I think that's been a really useful process for us and really interesting thing for us to be involved in. And it actually opened up some really good conversations for us about how we communicate this work.
Great. I'm just conscious of time. I've got a few more minutes. I did want to say something about our upcoming annual report, but I wonder just briefly, Grant, as well, just a question for myself. It kind of follows on from that, and it might not be a brief answer, but try your best if you can. But I mean, it was one of the points you made in one of your final slides about, do we have the data necessary to measure impacts and these modern methods that you talk about? I mean, is there any more you can say on that? I mean, what's your kind of view? I mean, is there stuff that's kind of going on with this kind of growing body of evidence that we need to do more of in Scotland, or work that you're already kind of plugged into that you maybe want to kind of say a bit about?
You don't quick answer. I think that there's clearly understanding the baseline and then seeing how things change afterwards is fundamental to good evaluation. So you can't see changes in something you're not measuring beforehand. So thinking about what data you have in place in order to, as you proceed with it, as you design the policy, is fundamental to doing good evaluations. So there's some really interesting work published the other day, and we've put out things through the project about the data that's available at local level. So if you want to measure impacts on GDP or house prices, well, where do you get that information from? Is it available at the level you're interested in? Is the health data available? Alison mentioned some of the limitations in making data from different perspectives consistent with each other at a common unit of measurement. All these things are really fundamental. And there's some really interesting new technologies coming out in terms of some of the Earth observation stuff about new data sets, which might be useful and interesting to answer some of these questions. But does it talk to all the existing data users that we have in policy? So
Great.
I know that's not a short answer, David. Apologies.
No, that's really helpful. And there's so much of that is also relevant to a number of things that the SHERU looks at in terms of the determinants of health inequality. So yeah, very important. So I think I'll leave it there. I think I'd just like to thank everyone for joining. I'd like to thank our three speakers, and thanks to everyone who also asked a question as well. I'd just like to say a bit about some of our upcoming work here at SHERU. So we'll be releasing our next annual report at the Fraser of Islander Economic and Social Policy Conference in September 18th and 19th in Glasgow, being held here at the University of Strathclyde. This conference is also a celebration of the Fraser of Islanders 50th anniversary. So the whole event is free to attend, so if you've not signed up, please take a look at it. I think there's a link being shared. It's also a link to from our website. As I say, it's a two-day event, and it'll host a varied range of sessions covering economic, fiscal and social policy. In terms of SHERU, we'll launch our annual report for 2025 on the Friday morning, that's the 19th. So this report will provide an update on health and socioeconomic inequality in Scotland, and it will feature a deep dive into prevention and death from drugs, alcohol and suicide among young men. So we'll launch our report, and then that will be followed by insight from the Auditor General for Scotland, Stephen Boyle. So I hope that's of interest to many of you. Hopefully a few of you are already signed up, and I will just close for today. So I just want to say thanks very much to everyone once again, and we'll hopefully see some of you at the conference later next month.